Hometown Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
Hi again, everyone. Time for our community service program. Today from Muenster Memorial Hospital, and Brian Roland, the CEO at MMH, is with us. How are you?
I am doing great and very excited to be here this morning. Beautiful weather, for a wonderful football game we're going to have later tonight. So I have to definitely say go Hornets.
Yeah.
I wish them the best. Would like to see them in AT&T Stadium next week. So really excited about what they're doing and what the kids are doing and how well they're playing. So really excited. Ton of stuff going on, though, in Muenster. Of course, we want to start off by wishing everyone a Merry Christmas. Before we know it, that's a week and a half away. New Year's is going to be here. So just a ton of stuff going on at the hospital right now.
Absolutely. And I guess among the things that you're concentrating on is trying to close out one year and start another.
Yeah, it's interesting in the healthcare industry. You have your calendar years, your fiscal years, and with our calendar year of 2017 closing out, and as we prepare for 18, we're really looking forward to what we've got happening this first quarter to 6 months in 2018. Albert Einstein said life is like riding a bicycle. To keep your balance, you must keep moving. And that obviously is true in healthcare. And for us right now, we've got a bunch of things that are kicking off here in 2018. I mean, obviously, by signing Dr. Ed to the 2-year contract extension, I think is wonderful for our clinic, wonderful for our patients. That's a big step forward. The respiratory therapy program that we're kicking off and the growth that's going to be involved with that. And as we look forward to adding more outpatient services with that, one of the things I'm really, really excited about is we're bringing wound care in-house back to Muenster. Years ago, we had it through an agency, and now we actually have one of our nurses, Kendall Ryder, who is wound care certified, who will be an RN, will train some physical therapy staff and one of our providers. So we can actually do inpatient and outpatient along with clinical wound care and actually be a benefit for our residents and our patients where they don't have to go elsewhere for that type of care. So it's those type of things, that you're really looking forward to in 2018, along with the things that we've been working on, chronic care management, unfortunately or oddly, Medicare's philosophy is how do we keep you out of the hospital? We keep building hospitals and growing hospitals, and everybody's expanding, but we don't want patients in the hospital. So with the chronic care management program, trying to work with the patients on a monthly basis that need that care and getting that up and going. The transitional care management, so if you are in the hospital and you leave, we make sure that we follow up with what you're doing. We're not just going to let you walk out the door and say, hey, thank you for being here. We'll see you next time.
Yeah.
It's how do we keep you to those steps to where we keep you out of the hospital. And I know that's kind of an anti-thought process for healthcare, but realistically, if we focus on the outpatient programs that we're working on in conjunction with the swing bed program, the rehab, and all the other things that we do, I actually think for us, we will build a stronger hospital and a stronger system in Muenster. And it takes those steps, in order to do that.
Mm-hmm. Yeah, and what you're saying about not forgetting about the patient when they're leaving the hospital, that extends really, I think, to most all departments. I know I was the beneficiary of my therapist after my knee surgery continuing to check on me afterward. And she was getting ready to have a baby, and she still took the time to check on me, and I appreciate that.
Well, and it's very important because, obviously, one of the things Muenster is really known for at the hospital is the quality of care and the care that we give our patients. A lot of hospitals, it's a numbers game, And it is. You have to look at these other things, but really that quality, that hands-on, that personal feeling, that's the nice thing about being a smaller rural hospital, is you have the luxury of talking to your neighbors and talking to your friends and making these calls and continuing to do these things. Because as we move forward and healthcare changes, those relationships are what are going to keep these small rural hospitals up and going.
Exactly.
When you've got, of course, we're doing things with Dr. Crow Rodney. March, she will have been here a year, and we continue to move forward with her. We've got the Healthcare Foundation that we're kicking off now that I'm really excited about, that I think will bring great things to Muenster and our healthcare organization. But one of the downsides to healthcare nowadays is our wonderful legislative folks. Winston Churchill says a pessimist sees the difficulty in every opportunity, an optimist sees the opportunity in every difficulty. And you really have to be an optimist when you deal with our legislative folks, because somebody comes up with a great idea and it snowballs. And the Ways and Means Committee is working on some things that could have some cuts to the reimbursement to small rural hospitals nationwide. And we're fighting that tooth and nail, because we can't afford to give that up. So those are the things that we have to be prepared for in 2018 also, because 17 and 16 we thought were bad years dealing with Austin and CMS and those groups. I think 18 is going to be one of the worst years, just because they keep, depending on what happens with the tax cuts, with what Trump's working on, somebody's got to pay for that. And where do they start? They look at the lowest common denominator. And the crazy thing is 90% of the patients are seen in rural healthcare, and we get 1/10 of 1% of the Medicare money in these rural facilities, yet they want to come after us first.
Yeah.
So it's really one of those weird things where, we keep talking about we have to manage today as we prepare for tomorrow. And it really is a true statement, because tomorrow is going to change, the day after is going to change, and depending on which legislative person wakes up on which side of the bed one morning and comes up with some great idea, we're all writing letters on, hey, this is why this is not a good idea. And 2018 is going to be no different. And so you have to try, and I tell my staff this and my board this, how do we get creative legally and stay one step ahead? And we really have to be using those tools that Medicare gives us and says, hey, look at the outpatient volume. Mm-hmm. Look at these other things, use those to offset this. And that's what our big goal for 2018 is going to be.
And as we get ready to start the new year, what are your top 2 or 3 priorities in the first quarter of the year?
I think that the 2 things we need to really work on is some changes that the Ways and Means Committee is looking at the reimbursement for critical access hospitals, and especially swing bed, and fighting that tooth and nail, because we've got to slow that roll. Because if that doesn't happen, and I mean, Drew Springer has sent letters, and we're Torch is getting involved. I think that's one of the big things. But I really think the other thing is really getting everybody to understand that the quality of healthcare in Muenster really is the driving force behind what we do, and that's driven by our staff. That we really do have probably the best staff in Cook County when it comes to healthcare. And people need to know that. Mm-hmm. And how do we get that out in a positive way to where we aren't sounding like we're gloating,
right?
But, we really are that good. Mm-hmm. And I think those are 2 big things.
Yeah, there is absolutely no doubt about that. I wish we had more time, because we could talk forever, literally, on some of the things that may or may not be facing you after the folks in Austin get done and the folks in Washington get done, because it's a daily changing thing. I know that. But we are out of time. I want to take time to wish you a very Merry Christmas and Happy New Year.
Thank you so much, Dee. And we've had fun working with KGAF this year, and I will see you next year.
All right. Yeah, we'll talk again next year. Looking forward to it. Brian, thank you very much. He is Brian Roland, CEO at Muenster Memorial Hospital. And that will do it for our community service program today here on KGAF.